How does H. pylori transmit between individuals? Imagine a tiny bacteria that can quietly spread from person to person, often without obvious signs. That bacteria is Helicobacter pylori, a common cause of stomach ulcers. Understanding how it moves between people helps us prevent its spread and protect our health. Most transmission happens through close contact involving bodily fluids. Saliva is a major route, so sharing utensils, drinking glasses, bottles, or even kissing can pass the bacteria. For example, if a family member has H. pylori and shares a spoon or a glass, the bacteria can transfer from their mouth to yours. This is especially common among children and within families where close contact is frequent. Fecal-oral transmission is another key route. If someone's hands are contaminated with feces containing H. pylori and they do not wash properly, bacteria can get onto food or surfaces. When others handle these contaminated items and then eat without washing their hands, they can become infected. This route is more common in areas with poor sanitation or hygiene practices, which explains higher infection rates in some developing countries. There is also a less well-understood pathway called gastric-oral transmission. This involves contact with vomit or gastric secretions that contain the bacteria. For instance, if someone vomits and the vomit contains H. pylori, close family members might accidentally swallow bacteria if they come into contact with the vomit or contaminated surfaces. Environmental sources like water and food can also carry H. pylori. In places where water sanitation is inadequate, contaminated water supplies can serve as a vehicle for bacteria to spread in the community. Eating food prepared with contaminated water or in unhygienic conditions can introduce the bacteria into the stomach. Studies show that H. pylori infection often clusters within families, especially in children. Mothers are frequently the primary source of infection for their kids in many settings, but in areas with high infection rates, siblings and other household members can also transmit the bacteria. The risk of infection is higher during childhood because of frequent close contact with infected family members. Adults can also acquire H. pylori, especially if they live in environments with poor hygiene or close contact with infected individuals. Preventing the spread of H. pylori mainly involves good hygiene. Regular hand washing with soap and water after using the bathroom and before preparing or eating food is essential. Avoid sharing eating utensils, drinking glasses, bottles, or toothbrushes with others. Ensuring access to clean water and proper sanitation also plays a vital role. If someone is infected, treating the infection can reduce bacterial load and lower the chance of passing it to others. While routine family screening is not generally recommended unless symptoms are present, being aware of how H. pylori spreads helps us take simple steps to reduce risk. This is especially important because H. pylori is a major cause of gastric and duodenal ulcers. By understanding and interrupting its transmission, we can help prevent new infections and the ulcers that sometimes develop from them. Always remember, if you suspect an infection or have symptoms, consult a healthcare professional for proper testing and treatment. Following good hygiene practices and staying informed are your best tools in preventing the spread of H. pylori and maintaining a healthy stomach.